Welcome to this presentation on Carbapenems Pharmacology. Carbapenems is a class of beta-lactam antibiotics that are known for their broad spectrum of activity, and they're typically used as a last resort when other antibiotics have failed. They are structurally related to penicillins, but they're more resistant to beta-lactamases enzymes, and they are the most potent antibiotics, which are widely used for treating infections associated with multidrug-resistant bacteria. These carbapenems show a broader spectrum of activity and they are less likely to be resisted quickly than other members of beta-lactam antibiotic class. When looking at the mechanism of action, carbapenems exert their antibacterial effect by inhibiting the cell wall synthesis. They do this by binding to the penicillin binding proteins, or BPBs, which are the enzymes crucial for the first stage of peptidoglycan cross-linking in the cell wall. This inhibition is bactericidal, meaning it leads to bacterial cell death. When carbapenems bind to penicillin binding proteins and inactivate them, they prevent the final transpeptidation step during bacterial cell wall synthesis, resulting in no elongation and cross-linking of the peptidoglycan in the bacterial cell wall. This means the bacteria cannot develop their cell wall and they ultimately die. The prevention of the transpeptidation process and cross-linking results in the accumulation of nascent peptidoglycans and can trigger the production of autolytic hydrolysis, which digest the existing peptidoglycan layer without the formation of a new one, further enhancing their bactericidal effect. There are four main carbapenems that are used clinically, and they include Imipenem, Meropenem, Ertapenem, and Doripenem. Each of these drugs has a specific pharmacokinetic and microbiological properties, making them suitable for different types of infections. Under the spectrum of activity, carbapenems are active against a wide range of microorganisms, and these include gram-positive cocci, although they are not effective against methicillin-resistant Staphylococcus aureus, which is a notorious resistant strain. They are also effective against many gram-negative bacilli, including an extended spectrum beta-lactamases or extended spectrum beta-lactamase producers and anaerobic bacteria. However, this type of antibiotics do not cover atypical organisms such as mycoplasma or chlamydia. The resistance to carbapenems can develop through several mechanisms, which include the production of carbapenemases, for example KBC and NDM enzymes, which directly degrade the drug. Other mechanisms of resistance include an efflux pump, which expels the drug from the bacterial cells, an alteration of the penicillin binding protein, which lowers its binding affinity, and a reduction of the permeability due to porine channel loss. This porine channel loss especially happens in Pseudomonas species. In the pharmacokinetics, carbapenems are administered intravenously due to their poor oral absorption. They then distribute widely in the body tissues, and some, like Meropenem, can cross the blood-brain barrier. With this activity, it makes them effective in the treatment of central nervous system infections. Carbapenems are primarily excreted by the kidneys, therefore, dose adjustment is necessary in patients with renal impairment, and among them, Ertapenem has the longest half-life, allowing a once-daily dosing. Looking at each individual agent, Imipenem is co-administered with celastin to inhibit its degradation in the kidneys. However, it has a higher seizure risk, and Meropenem is preferred for central nervous system infection due to its better tolerability and lower neurotoxicity. Remember, Meropenem can be able to cross the blood-brain barrier. Ertapenem, on the other hand, is unique because it does not cover Pseudomonas or Actinobacter and is administered once daily. Doripenem is known to have an excellent activity against Pseudomonas that is similar to Meropenem. Carbapenems are basically reserved for serious infections, and the common indications include complicated intra-abdominal infection, hospital-acquired and ventilator-associated pneumonia, complicated urinary tract infections, septicemias, and bacterial meningitis, especially when there is a resistant strain or organism. Some of the adverse effects that are associated with carbapenem use include a gastrointestinal system upset, hypersensitivity, seizures, especially with imipenem, thrombophlebitis, a low platelet count, anemias, leukopenia, brain damage and dysfunction can also be caused, a liver and renal toxicity, pustules and epidermal necrolysis, an increase in the heart rate and blood pressure, headaches, pain on the site of administration, sometimes there are complaints of insomnia, fever, and shortness of breath. Carbapenems should be avoided in patients who have a known hypersensitivity to beta-lactams, and caution is advised in those with central nervous system pathology or a history of seizures. In patients with renal impairment, the dosing must be carefully adjusted to reduce the risk of neurotoxicity. Some of the risks and limitations associated with the use of carbapenems is that we need to avoid in patients with allergic reactions to beta-lactam antibiotics and those who are taking valproic acids for seizures. Patients with neuro and hepatic disorders must be reported, and we need to adjust their doses accordingly. Imipenem, on the other hand, must be administered alongside with celestine and panipenem. Carbapenemases enzyme and metallobeta-lactamases can hydrolyze these drugs, reducing their potency. These carbapenems are expensive and difficult to find in comparison with other beta-lactam antibiotics, and they are only available in intravenous or intramuscular form, therefore posing a difficulty in their use outside the hospital or self-administration. Some nursing considerations when administering this drug is that it is important to monitor the renal function regularly, watch for signs of allergic reactions, for example rash or respiratory difficulty, ensure proper dosing is considered in patients with impaired kidney function, maintenance of intravenous sites to avoid development of phlebitis, and you need to educate these patients about the central nervous symptoms, for example confusion or seizures.